Hi everybody, it's Dr. Brenda
and Dr. Jen here at Revitalize.
So we've had a bunch of patients lately coming into our office that have told us their experience of pelvic floor PT at other clinics or with other therapists, and long story short, they haven't been happy with that, and that's why they're coming to see us. And so we just thought we would shoot a quick video explaining how our treatment approach is different than a lot of other clinics in the area.
So here at Revitalize, we take a very hands-on approach to helping you with your pelvic floor issues. We think it's important to get our hands on and kind of fix those issues manually versus just kind of hooking you up to a biofeedback machine. What a biofeedback machine would do is it tells you how well or how good you can contract and then relax the pelvic floor muscles. While that's great, that's not the only way to fix these issues that you're dealing with, and it can be really challenging to get a really good reading of those pelvic floor muscles without having your hands on and assessing, are the muscles tight, are they weak, and knowing what type of treatment you might need. So while this can be a good treatment approach, it's usually not the best way because we really don't know how those muscles are in terms of tightness and weakness and if that's going to solve the issue. It also comes down to a whole different issue in healthcare in terms of how many patients you can treat in an hour, and many times clinics will just throw you on something easy because they can fit more patients in that way, unfortunately.
Yeah, so a lot of people will sit and do biofeedback on the computer system for like 15-20 minutes, and that all increases their ability to bill, and then allow them to kind of move on to the next patient. And some of the billing that we've seen coming out of clinics is like
expensive.
Yeah, like hundreds of dollars.
Yeah.
For
you to sit on a machine.
Sit
yeah.
on, and
like
watch a computer screen with like electrodes on your lady part.
Yeah,
so
exactly.
That's what biofeedback is. We do it more manually, like Dr. Jen said. But the other big thing too is, as an out-of-network clinic, we pretty much do exactly what the patient needs and what's best for them to get them better faster. And so we aren't dictated by insurance with what types of treatment we can and can't do. And that's super important because a lot of clinics that bill insurance, even if they really want to do what's best for the patient, they're still kind of constrained by, oh, you can't bill certain codes together on one day, or because one code doesn't pay very much money, then they can't do a lot of that code in that day. So sometimes they're still really tied by what they can and can't do for treatment, even if it's not necessarily what's in the patient's best interest. So we just thought this would kind of
clear it up a little.
Yeah, and let you know, because a lot of people have no idea, and we've been seeing it a lot lately, and it makes us frustrated as PTs that try to do a really good job for our patients, because so many of our patients have now had this experience as pelvic floor PT, and that's their viewpoint or opinion of it, and unfortunately, like, that's not the case. It doesn't have to be like that, and it's not like that here. So yeah, anything you want to add to that?
Well, it might feel like it can be more of an upfront investment. You want to be smart with the money that you do have to spend, and many times still even going in network, we've been finding a lot of patients still have a hefty bill that they're getting after their copay in the mail, and so it's just frustrating to think that you feel like you might not be making the progress with pelvic floor PT when really there can be a lot of great assistance to you that can be worth looking for in a private practice.
Yeah. If you ever have questions too, like if you've been on the fence about pelvic floor PT and if it would help, reach out. We're happy to talk to you, take the time to talk to you on the phone, meet with you in person, and answer some of those questions. So, all right, everybody, have a great day, and keep those Kegels and pelvic floor strong.